Imagine a drug that could precisely control pain during surgery, then vanish from the body within minutes. This is the promise of remifentanil, a drug that has revolutionized anesthesia. Unlike traditional opioids like morphine, which linger for hours, remifentanil acts fast and disappears quickly, offering unprecedented control and safety. Before remifentanil, anesthesiologists often walked a tightrope, balancing pain relief and respiratory depression. Remifentanil's rapid onset and offset have been a game changer, making anesthesia safer and more predictable. It's like having a dimmer switch for pain control, allowing fine-tuning of sedation and pain relief during surgery. The introduction of remifentanil marked a paradigm shift in pain management during surgery. It has paved the way for advancements in surgical techniques, allowing for more complex procedures with faster recovery times. Remifentanil's magic lies in its unique chemical structure and how our body processes it. It's designed to be incredibly short-acting, with a half-life of just a few minutes. This rapid elimination is achieved through hydrolysis by an enzyme called plasma esterase. Unlike some drugs that rely on the liver or kidneys, remifentanil is broken down by enzymes in the blood. This makes it beneficial for patients with liver or kidney problems, reducing the risk of drug accumulation and side effects. Because it is metabolized so quickly, remifentanil doesn't build up in the body, even after prolonged infusions. Patients wake up soon after surgery, often with minimal pain and grogginess, allowing for faster discharge and a quicker return to normal activities. Remifentanil's rapid onset and short duration make it valuable for various procedures, but it comes with potential risks. One significant advantage is its ability to provide precise pain control during surgery. This allows anesthesiologists to tailor sedation and analgesia to the patient's needs and the surgical procedure. However, its rapid offset can lead to rapid emergence from anesthesia, sometimes accompanied by pain, agitation, and shivering. Close monitoring and appropriate management strategies are crucial to ensure patient comfort. Another potential risk is respiratory depression, a common side effect of opioids. While the short half-life reduces the duration of respiratory depression, it can still occur, especially with high doses. Careful titration and continuous monitoring of respiratory rate and oxygen saturation are essential to avoid complications. Administering remifentanil demands a delicate balance and constant vigilance. Its potency and rapid action require careful titration and continuous monitoring. Remifentanil is typically administered intravenously, often using a continuous infusion pump for precise control. The dose is adjusted based on factors like the patient's weight, age, health, and the type of surgery. Continuous monitoring of vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation, is crucial. Anesthesiologists are trained to respond promptly to any adverse effects, adjusting the dosage or administering medications as needed. Beyond the operating room, remifentanil's applications extend to various medical settings. Its unique properties make it valuable for managing pain in intensive care units. Critically ill patients often require mechanical ventilation and sedation. Remifentanil's short-acting nature allows for rapid adjustments in sedation levels, facilitating quicker weaning from the ventilator. It is also used in procedural sedation for short, painful procedures, like endoscopies and colonoscopies. Its rapid onset and offset provide comfort and amnesia for the procedure while allowing quick recovery. Remifentanil has significantly impacted anesthesia and pain management, and its future holds promising advancements. Research is underway to develop novel drug delivery systems, including patient-controlled analgesia, PCA pumps. These devices empower patients to self-administer small doses of the drug, providing tailored pain relief. Scientists are also investigating combining remifentanil with other medications to enhance its effects or mitigate side effects. These combinations aim to create synergistic effects, providing superior pain management while minimizing risks. As our understanding of remifentanil evolves, we can expect even more innovative uses for this remarkable drug.